historically, there have been concerns that when you get to clinical trials, meaning when you actually test vaccines on live humans, that that is a long process to make sure that both that it's safe and that it's effective. And there have been some concerns about were these vaccines adequately tested? Did we go through the normal process that we went through to figure out whether a vaccine should be widely distributed? And an issue that I think is on the minds of people more recently, was there a broad enough cross-section of people, including people of color, women as well as men, old as well as young, so that you had some sense of whether the vaccines were effective across the population equally for various people, whether there might be side effects for some people and not others. Tell us about that process, basically to test it out before we put it out there.
Yeah, it was extraordinarily well tested. Let me give you the numbers. In the Moderna product, we tested it on 30,000 people. In the Pfizer, 44,000 people. And on the J&J, 40,000 people. And one of the reasons things went so quickly is that we had so much infection in the community at the time that we tested it, that remember when we were doing the Zika, when we started testing it, all of the infections went down, and you go for years before you can prove it works. Here, it was like 3 months, and we were there because so many people got infected in the placebo group compared to the vaccine group that we knew it worked. That's the first thing. The secondly, we really went out of our way to get an equitable demographic representation. And it wasn't easy. We had to go out and really get leaders in the community to get people who they trusted to say, go get vaccinated. So for example, when we started off, the relative number of African Americans was relatively low, but by pushing it, we got it up to about 10%, a little bit less because 13% is the demographic representation of African Americans. We did better with Hispanics. Hispanics are about 18% of the population. We got up to 20% Hispanics in the thing. So if you put them together, about 30+% were minority populations. So that was really a critical point that you make, because now we could tell everyone that the vaccine was tested, it works, is safe and effective in all of these groups. So that's a really important point.